Well, as the days and weeks pass, it becomes increasingly clear that not only are we leaving the Omicron surge behind us, but we're entering a new phase of our experience with COVID-19. Case numbers and community transmission have continued to drop steadily, as have hospitalizations. Indeed, all but 10 of our counties now have low or medium community levels, according to the CDC. The 10 counties still at high levels include Ottawa to the north and 9 counties to the south, generally along the Ohio River. At one point in January, Ohio had more than 2,200 cases per 100,000 residents. Now our state average stands at 78. That's the lowest level we've seen since August. Similarly, while just 2 months ago, our hospitalizations were topping 6,000 people, today, fewer than 800 are hospitalized with the virus. Now, many communities, schools, and businesses have responded to these changes by relaxing masking and social distancing and other restrictions. Maybe you've allowed yourself a sigh of relief, and understandably so. The situation is improving, and our experience with COVID-19 is evolving from that of a pandemic to more of an endemic state. Reflecting these new realities, beginning on Monday, the state of Ohio will shift its reporting of COVID-19 data from a daily to a weekly cadence. In fact, Ohio has been one of only a handful of states still reporting COVID-19 data daily. Cases, hospitalizations, ICU admissions, vaccinations, which are all currently reported daily, along with deaths, which are reported twice weekly, will be reported each Thursday on our dashboard at coronavirus.ohio.gov. Likewise, data from our long-term care facilities and our partner agencies will also move to weekly postings. Now, all the same information will still be found on our dashboards. The only change will be the frequency of our updates. Now, even with this change, our state team will continue to monitor the trajectory of COVID-19 very closely. We'll continue to update our data, and we will continue to have close surveillance to help us monitor COVID-19 activity and to identify pockets of higher spread so we can work with local communities on timely responses as needed. Now, one reason for this shift is to better align Ohio with the new benchmarks established by the Centers for Disease Control and Prevention. Indeed, as you may recall, CDC's COVID-19 community levels, which were announced February 25th, moved away from relying on these daily case numbers as the sole measure of risk. Now, instead, the CDC is focusing on the severity of illness in a community, as reflected by the percentage of hospital capacity that's devoted to caring for COVID-19 patients, as well as the number of new COVID patients admitted to hospitals over the past week. In this model, new case counts averaged over the past week represent one prong in a three-pronged approach to risk assessment. Now, what's helpful about this new model is that it paints a combined picture of both the rate of spread and the severity of illness. That kind of picture is particularly important for an endemic respiratory illness that tends to ebb and flow, like COVID-19, or even influenza or the common cold. For example, we worry a lot about a wave of the flu that's landing many people in the hospital, even if a cold virus is circulating at the same time, infecting more people, but causing no hospitalizations. Thus, our COVID-19 community level allows us to judge the overall impact of COVID in any given county. Now, looking at the community levels in Ohio this week, 61 of our counties are at low risk, 17 are at medium risk, and as I noted earlier, 10 are at high risk.